I'm Ellen, one of the Remedial Massage Therapists, and I just wanted to do a little segment on foam rolling and why it's important. So foam rolling is a form of myofascial release, which is rolling a muscle over a large surface area. This can actually help with recovery from exercise, any tight muscles. So a foam roller looks like this. There are many different types. So this is slightly textured, but you can get some foam rollers with deeper textures. So what that does, it just actually gives you a slightly deeper release. I'm going to give you a demonstration, which is a lateral quad roll. Not for the faint of heart. It's one of probably the most uncomfortable foam rolls. I definitely know my quads are tight, so if you do hear a little yelp, so you need to go down onto the floor, pull all of those out that way. So you're going to lie on the floor. So the lateral side of the quad is here. So you're rolling over the top of the ITB, and we're rolling the muscle underneath, which is the VSL. So you're going to start, sit up onto the foam roller, keep the bottom leg straight, top leg bent, and you're going to roll over the side of the leg until you find a point where it feels quite painful. When you hit a painful point, that is where you need to hover. That has hit quite a painful point on my leg, and so if you hover, you can just gently move over the top of it, or you can hold the pressure down you can hold it for a little bit, just a few seconds, and you'll feel the muscle release. And you can roll up and down, and then you can stop. Sometimes makes you cry.